everybody. Glad you could be here today with us at Lowlink. I'm Jean Camo, Executive Director of Lowlink, and I'm really excited about today's session. We have obviously a large panel of experts here with us, and we're going to talk about Medicaid benefits and also Medicare. All right, so like I said, I promised that we would learn a lot about Medicaid today, and we're also going to cover Medicare. Unfortunately, our presenter for Medicare had a last-minute family emergency, so what we're going to do is have our Medicaid folks present. Then I, with the benefit of the materials sent by our presenter, am going to do a coverage of the Medicare, and there's some wonderful resources back there for you too. And then we'll have a Q&A session. So with that, I'm going to grab my glasses. And introduce Rosemary James, who's the Benefits Program Manager for the Orange County Department of Social Services. And we really thank you all for being here.
Well, hello, good afternoon, everybody. Hi. As Jean said, my name is Rosemary James. I'm the Benefit Program Manager with Orange County Department of Social Services, the Eligibility Unit, and I have with me a team of, I call them experts, even though they'll tell me, no, I'm not. I think they are experts. These are a wonderful group of women. I'd like to introduce to you Ms. Teresa Latimer. She's our Benefit Programs Supervisor. We have Crystal Shiflett. She's our lead worker, our trainer. We have Jahani Panagwa. She's our Benefit Program Specialist. We have Linda Jenkins, she's our Benefit Program Specialist, and Laura Lamb, Benefit Program Specialist. We are delighted to be here. We'd like to thank Jean for inviting us here. We have some wonderful information with packets back there for Medicaid. It's information that you can take with you, how to apply for Medicaid, how to apply for SNAP or food stamp benefits from the comfort of your home if you choose to do so. We also have paper applications for you. But if you'd like to take the paper applications home with you to complete them, drop them off at social services, you may do that also. Our presentation will be presented by Ms. Shiflett here. She has some wonderful information for you to share with you. And then following that presentation, if you have some questions that you would like answered, or if you'd like assistance filling out an application, you may do so at that time. So with that being said, Ms. Shiflett.
Thank you, Rosemary. My name is Crystal. It's wonderful to meet all of you guys. Thank you for having us here. So I have created a presentation to kind of just tell you about social services. What do we do? How do we help our community? What resources are available through us to the community? So from the benefits program standpoint at Orange County, we offer programs such as SNAP, which is Supplemental Nutrition Assistance Program, TANF, Temporary Assistance for Needy Families, Medicaid, Auxiliary Grant, and Energy Assistance. We try to be a one-stop shop for our community, but we don't have the available programs to cover everything. So we work with our community partners extensively, and some of the community partners that we work with, we call them resources. We work with the local food banks and distribution services. We have contacts through other programs for housing assistance. Transportation services such as Lowlink, community organizations, local churches and groups. We also work with the Department of Corrections reentry specialists for community members that are reentering our area. We work with Path Community Link to have extensive out-of-network resources available to our community members. We partner with the Community Services Board and PACE, which is the Program of All-Inclusive Care for the Elderly. We can give you more information on some of these programs if you want. I'll just talk about some of the benefit programs that we offer at social services. Energy assistance is one that is a big deal to a lot of people. A lot of our community members struggle to pay electric bills. With the cost of everything rising, it's becoming more of a frequent need. So we do offer fuel assistance that helps with energy costs during the winter months. Applications are accepted the second Tuesday in October through the second Friday in November. Each of our programs has a limited window for application for the energy program. The crisis assistance helps with energy-related emergencies. If you have a disconnection, if your heat pump goes out, your air conditioner has gone out, it can help with repairs and things like that with some limits. Those for the heating program are accepted November 1st through March 15th. Cooling assistance helps during the summer months with energy needs for vulnerable households, and applications are accepted June 15th through August 15th for that program. A couple other programs that we offer, TANF and SNAP. Many people haven't heard about the TANF program because you have to have a child under the age of 18 in your home. As we have more older caregivers caring for younger generations, maybe a grandparent caring for a grandchild or something, this is a program that may be helpful to supplement some of those needs in that household. SNAP, as I mentioned, is a supplemental nutrition assistance program, and it can help provide a portion of your monthly food needs. It's not designed to cover your entire food budget for the month, but it does cover a vast majority of it. Once a month, you'll get a deposit on an EBT card, electronic benefit transfer card, for use online or at the grocery store. In addition to purchasing food and drink items, the SNAP program can help purchase seeds for a food garden like cucumbers, pumpkins, tomatoes, so you can sustain yourself through the remainder of the year and everything. So, to the main portion of our presentation, Medicaid. As of January 1st, 2023, Virginia Medicaid has transitioned into a new name. It's still the same program, still the same coverages, but we're now called Cardinal Care. What the idea behind that was to wrap all of these separate organizations. We worked with Magellan 4.0 and the CCC Plus, and they incorporated all of them into one unit. So Medicaid has several coverage groups that cover families and children specifically. They offer long-term care services either in your home or in a specialized facility. We offer ABD coverage, which helps supplement the cost of most Medicare programs. We do offer that to groups that are age 65 or older, blind, disabled, have some sort of disability to meet that criteria, and they're also receiving Medicare. And we also offer auxiliary grant services. So what's happening with Medicaid now? Medicaid is in a transitional period right now because of COVID-19, the public health emergency. We were prohibited from closing, reducing, and making changes to any open enrollees coverage. So the federal government has lifted those restrictions, and as of April 1st, we have returned to normal pre-pandemic operating procedures. What that means is that every open enrollee right now in the next 12 months is going to go through a renewal. So we're going to reevaluate eligibility to ensure continued coverage. We're working with community partners, advocates, and members to make sure that eligible Virginians continue receiving high-quality healthcare coverage. It's one of our main goals. One of the most important processes for us currently is to ensure that individuals keep and have access to health insurance coverage. Just because the pandemic ended, COVID-19 is still around. So now that we're talking about renewals, what can our members do to ensure that they keep their coverage and continue eligibility? They can renew their coverage. They need to update their information by calling Cover Virginia, or they can contact their case manager at Orange County Social Services. We need to have current information on file so that our members can get their packets, can get their notices, and can get information from us so that they keep their coverage. If there are questions, members can always reach out to their case manager for more information, to report those changes. A really important thing is to watch your mail. Respond quickly to notices. We have a lot of complaints that sometimes the mail is slow. So if you get your notice, open it, return it back to us, and that helps speed the process up. You can also sign up for email and text updates and follow Cover Virginia on social media. I know this could be a Medicare presentation, but I kind of want to talk about how Medicaid and Medicare work together. Medicare is the national health insurance program for individuals who are 65 and older or disabled. The program is facilitated by the Social Security Administration, No, I know it sounds a lot similar to our social services and social security, but we are two different agencies. Eligibility for Medicare is based on a person's age or disability status and their work history with Social Security. Eligibility for Medicare is not based on a person's income or resources like Medicaid is. So Medicaid works with Medicare to provide a program called MSP. When the MSP is Medicare Savings Program. So if you qualify income and resources for either 80% QMB, SLMB, or QI, then Medicaid can pick up your Part B premium, and it can also pay for other deductibles and like your Medicare Part D. If you do have a cost for Medicare Part A, you can pick that up. If you qualify for 80% or QMB with some limitations, it can also pay deductibles and co-payments for what's left over from Medicare. Medicare Part D is a prescription drug plan that helps to pay for medication that your doctor prescribes. Enrollment in Medicare Part D is not automatic for most individuals. You would need to contact the Social Security Administration to check on your eligibility and your enrollment for Part D. To better understand options for Medicare Part D, there is a website, medicare.gov, that you can go and check the offered plans and see what may work for you. A lot of times we get the question for individuals that are turning 65, what if I can't afford Medicare Part D? That's where Medicaid comes in. So if you have low income or limited resources, you could probably qualify for Medicare Part D extra help. This low income subsidy covers all of your Part D premium, and it offers reduced co-payments for prescriptions. Individuals who are enrolled in Medicare and Medicaid, dually eligible individuals, are automatically enrolled in the Extra Help program. Long-term care, that's what a lot of clients that participate with LowLink, they could really benefit from some of those long-term care services. So Medicaid offers LTSS services by using waiver services. Applicants have to be screened for waiver services unless they are a resident of a nursing facility at the time that they apply for Medicaid. Waiver services are offered to both children and adults in the state of Virginia. One of the options for waiver services is community-based care. It allows you to stay in the comfort of your home. You can have skilled professionals, a nurse, it could even be a family member, care for you in your own home and still get paid by Medicaid. They can help with your daily living tasks, medications, cooking, light housework, help with laundry and things like that. Another option for waiver services, if staying in your home just isn't feasible for you, is nursing facility or skilled care. And when you talk with a screener and a person from social services, they'll determine your level of need with you to see what best fits your situation and how to keep you happy. Because we don't want to uplift anybody. If you want to stay in your home, and we can make that happen. So the Commonwealth Coordinated Care, the CCC Plus waiver that I mentioned earlier. This is a waiver that provides care in the home and in the community rather than in a nursing facility or other specialized housing arrangement. Once approved for Medicaid eligibility, screened and approved for the CC Plus waiver, individuals can choose their own desired waiver services. You can pick your own provider. You could have a nurse come in, as I said earlier, could be a family member. Services that are covered through the CCC waiver include personal care services, respite services, private duty nursing, adult day health care, assistive technology, environmental modifications, transportation, and some more benefits, some additional benefits. It's a really good program. To talk about what an environmental modification and its assistive technology waiver is, environmental modifications, if an individual medically needs physical changes to their primary home or vehicle to ensure their health, welfare, and safety by providing ease of accessibility and greater independence. So it helps individuals remain independent in their own home. The assistive technology waiver specializes allows specialized medically needed portable equipment and supplies, including devices and controls or appliances, which help an individual increase their ability to perform their daily activities or to assess, control, or communicate with their living environment and community. This could be your individuals who need help hearing or phone-assisted devices to be able to communicate. And last, auxiliary grant. This one is really wonderful as well. An auxiliary grant is financial assistance for people who receive supplemental security income. And certain other aged, blind, or disabled individuals who are entering or already living in certain licensed or approved facilities that accept auxiliary grant payments. So what does an auxiliary grant cover? It can cover your room and board, provision of a furnished room to a facility, so you don't have that extra expense of furnishing your home, housekeeping services based on the needs of the resident, meals and snacks, including extra portions or special dietary needs, clean bed linens and towels as needed by the resident and at least weekly, and maintenance and care, such as transportation, help with medicine, help with health and hygiene items. It can cover a lot of that. So if you do have an individual who is in need and not currently receiving any of the services that we offer, there are several ways that an application can be submitted. It can be in person at our office. We're open 8 a.m. to 5 p.m. Monday through Friday with the exception of state holidays. You can mail an application. So if you call and want one to be mailed to you, we'll send it to you the same day that you ask. They can be received by fax, phone, or online. We utilize commonhelp.virginia.gov for Medicaid applications, and you can also use the federal website healthcare.gov to apply for Medicaid as well. That's all that I have to say. Thank you, guys.
I think we have time for a few questions right now before we go on.
So, we'll open the floor for questions and hopefully give you some answers.
Yeah, I mean, Deb's mother just got qualified, or she was under Medicaid, but the difficulty was finding a facility that would take Medicaid, so she was in a assisted care facility where you still had to be a payer until a Medicaid bed freed up. So I was wondering, from an Orange County perspective, is it normally a wait list and that type of thing? And again, because it's also, you got to be, really have almost no assets left to qualify for Medicaid. So
She waited 20 months to get a bed.
Yes.
To get a bed.
And if you could repeat the question, just so.
Okay, no, I'm just saying.
I mean, our speaker.
Oh, speaker,
Yeah, yeah.
okay. Mhm.
Okay, so what I'm hearing you say is there typically a wait for a Medicaid bed due to limited facilities in the area? That can be a common occurrence. We try to not refer people to a specific residence or facility, because if a person has a bad experience and everything, we would not want to be liable for that. But it would be very helpful for our community to have more Medicaid-friendly providers. I'm not sure if that's something that can be worked on, but it's definitely a known issue. And there can typically be a significant wait, especially if there's a particular facility that you're interested in.
How many facilities are there in Orange County, if you're trying to stay more local?
It's limited. I would say less than 5.
Less, and the biggest being Dogwood, probably?
Yep.
But if you're approved for the services, you don't have to limit to find a facility in
Right.
Orange.
Right, I know.
And I know it's easier for the family, have the person close to.
Right,
But if you open your range a little bit,
right.
it is a lot of good facilities.
And I was going to
If you
say,
have to drive.
to get her into a facility that may not be closer to home,
Mhm.
but keep yourself on the wait list for the
Yes.
place that is closer to home,
Mhm.
so that she can then be transported
Okay.
later. But I would expect that as our generation is aging, that we're going to continue to see the waiting list grow. And we don't see a whole lot of nursing facilities opening,
Closing.
And then, right, and they tend to be, catering to a different
Right.
clientele than what we would typically service. So, yeah, we've been hearing a lot that the wait times is long.
Well, yeah, because
Yeah.
Dogwood was 20 months or so, but part of that was COVID period where they
Yeah.
couldn't take anybody and so forth, but,
Yeah.
but it is there. I guess I'm gonna just ask another question. With, you hear on TV that some of the academic benefits and money flow is drying up. We're talking about school lunches for kids, money's not gonna be there. How about SNAP and so forth? Do you guys see that being hit because there's not gonna be as much money flowing down?
So what I've heard is our programs impacted by lack of COVID funding.
Right.
And yes, that is correct. We've had a big impact to the SNAP program specifically with that during COVID, what applicants or enrollees were receiving were called extra benefits. So if you had a household of one person and that one person had a job and they made $500 a month, then their SNAP would not be the full benefit because they had income counting. So the maximum benefit that a household of one can receive is $281. So the purpose of the pandemic funding was to increase every applicant to the maximum benefit for their household size, regardless of how much income they were making. So basically, we were evaluating SNAP benefits on everybody making zero income so that they were entitled to receive the maximum. What would happen is if you had income, you would get your normal allotment in the beginning of the month, and then on the 16th of the month, there would be an additional supplement deposited to your SNAP card to bring you up to that maximum limit. If you were already at the maximum limit during COVID, you received an extra $95 to your SNAP benefit. That extra benefit stopped when the funding ran out, right around March of 2023, so it was a really good run. But yes, we have had some serious impacts to the programs due to lack of COVID funding now.
Is that the primary program that you've seen under your umbrella where there was extra money?
Yes,
That was the
very
money?
visibly extra money. I mean, Medicaid had included services in it, so if you were a long-term care waiver service and receiving community-based care in your home, there were additional waivers granted to allow family members, parents to take care of disabled children and things like that, waivers that were put in place during COVID that weren't there previously. But we're still in the unwinding for the pandemic, so those waivers are still being reevaluated. They could go away, but it depends on, a lot of decisions from people
Who
a
are
lot
not
higher up.
in this room.
Well, again, on TV you hear, because like you said,
Yes.
with everybody on Medicaid, because you couldn't reassess annually to make sure you still met the conditions,
Yeah.
that a lot of states are kicking a lot of people off, and that's why you're starting to see healthcare.gov being advertised on TV and
Yes.
so forth
Yes. Yes.
as
Yes.
a fallback, but
Mhm.
have you guys seen, I know you guys are probably still reassessing and trying to reach out to people to make sure they qualify yet?
Yes, so for the state of Virginia, we have about 2.2 million enrollees that are going to be reviewed within 12 months, and that started April 1st of 2023. So we still have a long road ahead of us, but we've covered a lot of ground too. But yes, healthcare.gov is an available resource, and if you still are within certain income and resource limits, healthcare.gov will refer you to Medicaid. So you still could be entitled to Medicaid through the healthcare.gov website.
And I would say the biggest change that we've seen so far is not going from full Medicaid to no Medicaid. It's been going from full Medicaid to reduced Medicaid, because the majority of our clients that
Age.
changed, their age has changed to the point where now they're in a different age category. And now they're getting Medicare Part A and Part B, and their retirement income has significantly increased over the past 3 years. So we're seeing more of a change in the level of service, more so than the change in you're not getting Medicaid anymore.
Yes.
I know of a friend who's 91 years old, lives in Fredericksburg. She can't drive, but in your explanation here of the benefits, she gets 3 meals a day delivered to her every day. In front of her door, she has a cooler.
Yes. Yes.
And is that part of
So certain benefits like that are only available in certain counties because I don't think that Orange County per
They
se
don't have
has,
one.
doesn't have those type of services to offer. Now, that doesn't mean there aren't local churches or other community organizations that provide, home delivery of meals. I do believe some of the food banks will offer that to some of the services, but there is no Medicaid-funded
For that.
meals program.
Right. It's just not something that's in Orange County at the
Yeah,
moment.
some of the smaller
Oh,
counties don't
Yeah.
have as many resources available to them as
Yeah.
the larger localities.
Right.
No, I was just wondering about that, you
Yeah.
know?
Mhm.
She's a good friend, she used to live here at the Lake of the Woods, but she can't drive, she can't cook, she's all by herself in the house now.
Yeah.
But she gets just 3 meals a day, every day.
Yeah.
Good.
I
Yeah.
tasted some of them
Bigger
too.
community.
Yeah,
Because I visited with her and I well, come on, I got a freezer full of food, so.
Yeah, I think
The other
that's the Meals
question-
on Wheels program. Those are awesome.
The other scenario I have is on the Facebook.
Yes.
I've been seeing an ad of this affordable connectivity plan.
Yeah.
Okay. And I was at Xfinity the other day to inquire about it, and I thought it was for senior citizens. And no, she said no. So I went online, she gave me the website. And apparently there are different categories, different plans, okay? Now for us, we all have to use internet service. It's a $30 reduction in your monthly bill from Comcast or Xfinity. Is Medicare involved in that?
Medicaid and Medicare is not involved in that. No, that was something that came out of, I do believe, COVID.
Yeah, I think it was
Started that.
because
Children were being.
because of the kid, because
Yes.
schools were closed.
Yes.
And everyone couldn't afford.
So now it's a
High-speed
government
internet.
program, affordable connectivity.
Right.
Yeah.
And I think they started offering it once the high-speed internet got out to the more rural areas. Because kids were having to come all the way into town, and they would sit in the parking lot at Orange Library or at the schools to use internet. So, yeah, I think that was part of the high-speed internet plan here, but yeah.
Well,
Yep, the
I
broadband
just think if we can get
initiative.
$30 off our bill, why not?
Absolutely.
It's about $360 a year.
Yeah,
Yeah.
it's a program available to, I'm sure that they have certain qualifications to receive the benefit, but it's open for anybody to apply to.
Yeah.
No, the other thing I've been picking up on the Facebook or, my daily news stuff is they're saying that there's a deadline to apply for some kind of card that you can use to buy your groceries.
Talk about Social Security, I think that's wrapped in the extra help.
Yeah.
Because the extra help program through Social Security can provide meal supplements, it's money for food. It can provide quite a bit of different things,
Yeah.
local resources.
I think that's a
You have to
Medicare.
be on
Yes.
the dual eligibility.
I mean, I get this text message every day, I mean, the deadline, and they're offering $3,380 to me.
I wouldn't respond to a text message. There
No.
are many, many scams that are going around.
Yeah.
A lot of scams claiming, hey, benefits
Yeah.
are running out, funding's running out, apply now, to kind of encourage people to give up their information. So
Exactly.
I honestly wouldn't suggest replying to a text
So
message or
it's
anything.
I would research it on Medicare.gov.
Yes, or Social
or
Security.gov,
SSA.gov, yeah.
Social Security.
Yeah.
things like that. Yeah.
Yeah, I would go direct to the website that, SSA.gov.
Well, I haven't filled it out because, if
Yeah.
I'm white, I don't think I would
Especially if it's on
qualify.
Facebook.
Yes.
Yeah.
Don't follow links on Facebook.
Or a text message. Oh
That's my
goodness.
free info for everybody. Do not follow links on Facebook.
When you type in ssa.gov,
Yes,
make sure that that's what you're getting when you
Yes.
choose, because the first thing that comes up surprisingly a lot is not ssa.gov.
Yes.
And look for
It's
the
ssa.scam.
it should be a lock at the top
And a lock
next
at
to
the top.
the,
HTTPS.
Yeah.
Yes,
Social
HTTPS.
Yeah.
Yes.
//
Yes.
yeah.
and
Oh, I
look
know
for a
that.
lock.
I
If
work
it's
in
not there,
computer, yeah.
get off the page. Yes.
So,
Thank you so much. These questions are really great. We're going to ask you to stay and take some more questions afterwards. A couple things that came up during the conversation is, it's never too late to talk to an estate planning attorney. And we've talked about holding a presentation in the future, so if there's general interest by Lowlink, members and volunteers, that's something you might look at for a future speaker series. Because it help you sort out, is Medicaid going to be a part of my plan? What do I need to do? And so, just kind of wanted to share that. And also, thank you so much for talking about the scams out there. I was busy one day helping my parents, taking phone calls left and right, and somebody called and said, oh yeah, we've got these, things through Medicare for you that, we're going to send to you. And I'm thinking, oh yeah, I guess my parents need them. And I got a little bit into it, and all of a sudden it was like, wait a minute. Something's going on here. So it's so easy, and we just all need to be vigilant. We also appreciate Triad, who will probably be coming out and talking with us in the next few months as well to talk about that. Also, kind of just wanted to speak to a little bit your question about Medicaid beds and how can Lowlink be involved with change. So Lowlink, of course, what we do is we provide services and social activities to help enable us all to remain in our homes as long as possible. But we're also a powerful community of people who know, what we need and what's important. So we're also powerful advocates. And so that's individually, just in our own homes, we can advocate for the needs that we know are important to our community. But also as an organization, we're increasingly getting involved at the state level and even federal level. So if you're ever, wondering whether you should join Lowlink, be a part of something that's great and part of a growing voice. And that alone is just worth the price of membership, in my opinion. So we hope that you'll check out Lowlink if you're not already aware of it. Okay, I'm going to take a few minutes and put on my Medicare hat. I do not claim to be an expert on Medicare, but I am so thrilled with the resources that Jenny Zamora sent over. So I'm going to kind of share those. But first I'll talk about, it's called the Virginia Insurance Counseling and Assistance Program, also known as VICAP. So it's a statewide thing, but you can call and make an appointment. There's an 800 number, but also Jenny has some cards over there because you can make an appointment directly with her to learn more about Medicare by sitting down individually. And I understand the Medicaid folks will do the same thing, sit down with you individually. So please, again, feel free to grab materials over there. Medicare, important things to know. This is a really great little brochure. As many of you may already know, there's several parts to Medicare. So Part A is your hospital insurance. And for a lot of people, that ends up being available at no cost. But then there's Part B, which is the medical insurance, which covers your outpatient care and that sort of thing. So just to kind of go through the list, Part A, hospital insurance, covers inpatient care at the hospital, skilled nursing facility. And again, it's the insurance part, not like covering your stay there. Hospice care, home health care, inpatient care in a religious non-medical health care institution. Part B covers services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and many preventative services. And then many of you have heard about Part C. Does anybody know that? Okay, yeah, Medicare Advantage. That's just another way of calling Medicare Advantage. So there is a possibility of choosing sort of regular Medicare, or you can go with the Medicare Advantage plan. Regular Medicare, you can typically go to any provider. You don't typically need to get a referral to a specialist, although there's always exceptions. Whereas and that's provided by the government, whereas the Medicare Advantage plans are private plans, so the government pays private entities to run these programs. They tend to have lower, or in some cases no, monthly fee, but you are limited typically to the in-network providers, and there's a HMOs, PPOs, a lot of different plans under the Medicare Advantage. And it covers Part A, Part B, Part D typically, and often dental, vision, and that sort of thing. So on the one hand, it's a nice package and it can provide a lot of coverage, but on the other hand, you just really want to weigh the advantages of both types of programs, because if your favorite doctor is not in network and you don't want to switch, you would want to know that before you made a decision. So Medicare, of course, is open to people when they turn 65, or in some cases if you have a disability before 65. And in addition, you can make changes during open season, which is coming up, which is one of the reasons we're having this program now. And so October 15th through December 7th is open season. And then if you decide to make any changes, then the changes will go into effect on January 1st. So, let's see. Again, just so many great resources. I really am impressed with.
Just want to make one comment,
Yeah.
is that, like you said, it's at 65, you do have to sign up if you're, within a time frame, or
That's
if you're
true.
still working,
Right.
that you can wait. One thing, if you do go to a Part C plan, and you do that for a couple years, and then, like you said, open enrollment, and you want to go back to Medicare, they can reassess you, they can refuse you. I just wanted to note
That's
that.
an excellent point, and that's why I say I do not claim to be the Medicare expert, but what he mentioned was a good reason to do solid research before you sign up or before you change, because when you go to an Advantage plan, it can sometimes be hard to switch back to a regular plan if your needs change. And to your point about signing up, this is my year. And so you have 3 months before you turn 65, the month you turn 65, and then 3 months after to sign up. If you sign up after that, there is a penalty. But again, that doesn't necessarily mean that you shouldn't evaluate that, because if you do have other coverage, and 10 years from now you need to go on it and you have to pay a penalty, you may still come out ahead. So, I wish I could just say, oh, here's the easy answer, sign up. But like everything else, it takes a little doing to make sure that you're choosing the right plan at the right time. But I will say that if you pick up these materials and read through them, that you'll get a lot of great information to help guide you. And of course, Medicare.gov is available. And Jenny through VICAP is available. So again, everybody needs a clip on the refrigerator, but in here is also lots of guidance. This is one of my favorite little things. I use this all the time. This was, your Medicare card on one side, and a few years ago, my COVID card on the other. But it's kind of handy, just to kind of grab and go. So, that's a very high level. If Jenny were here, she'd give you all kinds of details and be able to answer questions, and I don't want to go beyond my expertise, but I did want to at least offer you that and the resources. So does anybody have any questions that I might be able to answer? All right, great. All right, so with that, I am going to open it up again to questions that our panel here might be able to answer. Does anybody have anything else? Yes.
Staying on Medicare a little bit longer.
Okay.
The question I have always asking myself is, I have Medicare, and I also have private medical insurance, so that the coverage is hopefully 100% rather than 80% or whatever.
Right.
But the questions that I keep asking is, because of that, I haven't enrolled in anything other than Part A and B. Would it be less expensive, or what's the comparative coverage if I would enlist in Part D or any of the other variables versus the private insurance? How can you get a comparison?
And I think sitting down one-on-one with somebody, like, through VICAP, it can be very helpful because, having Part D, which is the prescription coverage, can be very important. And there's a wide range. I've seen it just from personal experience with family members where there's actually some plans, at least in the past, that had a zero monthly fee all the way through, higher amounts. And then there's also, of course, Medigap coverage.
Sitting down with who?
VICAP is Virginia, let's see, right here. It's the, make sure I say it right, Virginia Insurance Counseling and Assistance Program. And there's somebody right here in Orange County that you can call, and I'll give you this brochure.
Please.
And she can set up an appointment and sit down with you, and you can kind of go through some of those, here's my specific situation. I will tell you again, based on my personal family experience, that I had a family member, unfortunately a young person, who had a significant medical issue, and he was on Medicare, Medicaid, and he actually had Blue Cross Blue Shield through the government. So he was very, very fortunate. He had coverage up and down, and for him it paid off because he had significant needs. So, you can choose either or, you can layer, there's a lot of different
that's my
options.
situation too. I'm with Blue Cross Blue Shield.
Yep.
And my wife had the same thing. She needed a lot more coverage than I did, and was essentially paid nothing, other than the monthly costs are significant.
Right, the monthly costs are significant, and if you had a crystal ball, you would know which one to choose.
And
So
whether you should have,
Right.
okay.
Yeah. But yes, I encourage you to do that, and go on Medicare.gov, and, pencil and paper sometimes can help you just, look at the costs and decide which, am I willing to take the risk if I drop this or not? So, but those are really good questions. Thank you for asking those.
Just want to make one more comment, is that we're under a Part C plan.
Okay.
And so, again, their sites don't always, like you said, check if your doctors are in, although we're fairly new to the area and so forth. But again, doctors can come in and out of those plans and so forth like that, and we just have gone through that in the last couple of days, trying to find a certain care level and so forth. And while I think if you go back to original Medicare, as long as they accept Medicare, which I think would be much more coverage, per se. Now the expense may be more, on a month in, month out basis per se, assuming you're not really spending money. But again, with plans on their Part C, whoever it may be, they can have a whole different list of doctors year in and year out.
That's true. The doctors could change under the Advantage plans, right? Yeah. So it is sort of partially. It is partially, financial, but it's also partially, your preferences and your doctors and how important it is to you to stick with your current doctor, which, continuity helps. So, yeah, it's a good comment. Any other questions on Medicare or on Medicaid or anything related? And I think I understood that you were available also to meet with folks
Yes.
today if they wanted to go into another room, or is that?
Yes, if you need one-on-one or you need help filling out applications, just let us know.
What are some other ways that we might be able to help through this area of the county to assist people who may be in need of your services? How would you suggest we reach out as a community?
Well, this for one.
So you're working with a lot of the community members and everything. If you see somebody that has need, tell them to call us. We are just a phone call away, Monday through Friday. We have voicemail for any other time. Just give us a phone call, local number, and every person has different needs, so we cater each case individually. We can see what we can do to help.
If someone needed transportation and they weren't a member of Lowling, for example, how would you refer them to get that transportation?
We would refer them to the Foothills Mobility Services. We have other community organizations that offer transportation if they're not currently enrolled in Medicaid, because some Medicaid managed care organizations offer what's called a Medicab. So that's a ride to and from any medical appointments that are necessary. But of course, you have to be enrolled in an MCO through Medicaid to get that type of access.
Right.
But we do offer community resources such as LoveLink and other ones, Foothills Mobility Systems for transportation, Voltran.
It seems as if the churches pitched in a lot during the pandemic. Are you finding that's continuing?
Oh,
That
yes.
they're,
Probably even more, increasing.
I think the, quite a few of the local churches have their own little organization, and we do partner with them on quite a few things.
And I know, I was talking,
CEC, thank you.
and you were talking about the assistive technology and environmental waivers, yes. And so, you know, if somebody kind of came in through that door, like, wow, this is something that could help me, not necessarily looking for the other benefits, what would that look like?
So if they applied for Medicaid, qualified for the waiver services, and they needed any of these assistive technology or environmental waivers, it would look similar to, you know, they let their care provider know, I need a wheelchair ramp, or I need bars in my bathroom to be safe. Doors widened.
Communication devices.
Right.
So it's a vast list of things that.
And they work through their Medicaid provider, their MCO, their care specialist to get those. We at Social Services don't put them into contact, but it's through their care coordinator, through managed care.
And I'm sure that there are people who actually come out to your home to do these things, you know, because you would think that the state would have to clear them. You know, to make sure they're not just having, you know, Joe Smith who just got out of jail come out to your house to get a grant. You know, little things like that. So they have vendors that have been vetted, and our job is to evaluate you for eligibility for Medicaid, which then in turn allows you to be able to take advantage of the other services.
And my question was, if someone were to let us know that, you know, I need some adjustments made to my home due to a disability, if they were to call you and that was the question, I need a ramp, would you back into that as to see if they were eligible for Medicaid? Or would you simply ask them, are you on Medicaid?
Well, if a resident calls us and asks us any of those type of, you know, resource questions, of course, we would get their information, and we have the ability at that exact moment to see if they're open to Medicaid and the type of Medicaid that they have, and possible coverages, and then we instruct them on how to contact their care coordinator through either the number on the back of their MCO card or other means, but we refer them to where they should contact.
So if someone brought that kind of concern to us, we could send them your way without having to ask them what type of coverage they had.
Absolutely.
So I just really want to thank all of you for coming here today. This has been so helpful, and we really appreciate it, because I think, you know, sometimes you know it's out there, but meeting the people who actually deliver the services are, you know, it's just very powerful for us, and so we really thank you for being here. And
Thank you for having us.
I think you'll be around for questions as we mingle a little bit, but yeah, thank you again.